When COVID-19 hit, research on impact of marginalized and vulnerable communities did follow up quite quickly. However, due to the still prevailing lack of visibility and of knowledge about intersex people and special needs and situation of intersex people, intersexualities were not considered. This is when the international intersex community took action. A specific survey on intersex issues was initiated by OII Europe and conducted by the international intersex community in different regions of the world. The questionnaires were adapted to specific regions in order to allow gathering of the most accurate information. We are delighted to now welcome intersex experts from 4 regions who will speak about findings of surveys on the situation of intersex people and their families in times of COVID-19. It is my pleasure to announce that with us today we have Dan Christian Ghattas, Executive Director of OII Europe and a policy expert on intersex rights. He will report on OII Europe's findings about the situation of intersex people in Europe and Central Asia in times of COVID. We also have Hiker Chiu, Chair of Intersex Asia. Hiker is a pioneer of the intersex human rights movement in the Asian region, including being the first person to come out as intersex in Taiwan. Hiker will give insight in the findings of Intersex Asia COVID-19 survey in Visibility Amplified. We have Gaby Gonzalez, coordinator and activist for the human rights of intersex people in Argentina from organization Orquidea Intersexual. Gaby is currently working on a report about the findings of the COVID-19 survey conducted in Latin America. And we have Obioma Chukwuike, intersex and human rights activist, founder and executive director of Intersex-Nigeria, and member of the Africa Intersex Movement. Obioma will present the COVID-19 report on the situation of intersex people in Africa. Welcome, everyone. Thank you so much for being here. And then I invite you to start, please, then continue.
Thank you, Irene. Maybe just let me start with saying that this collaboration on the global COVID-19 intersex-led survey has been an amazing experience and a really collaborative effort of all people and organizations that have been part of that and are still part of this. This is really something I want to highlight because it's been done without additional funding and with a lot of volunteer work and supporting each other wherever we all could. Many surveys, as Silvan already mentioned, were developed and launched after the beginning of the crisis. And we know that many intersex people have reported to OII Europe and also globally that the available surveys did not address the specific challenges created or aggravated for them by the pandemic. And then, as Irene already said, we, as OII Europe, with the support of the European intersex community, set out to create a questionnaire that would help to gather more detailed information, first in Europe and Central Asia, about important areas of lives of intersex people and their families in times of COVID-19. And I will now present some of those findings. You can find our report as well as the COVID-19 report infographics on OII Europe's website. The survey, so the European and Central Asian survey, was filled out by 63 intersex people, including 6 minors and 3 family members of intersex people, coming from 16 countries from Europe and Central Asia and 3 sub-regions. So we basically put the countries together in sort of sub-regions, first being Eastern Europe, the Balkans and Central Asia, then Southeastern Europe, and then Western Europe and the Nordic countries. Fundamental rights are easily breached in times of crisis, as we all know, and harassment, discrimination, and other forms of violence increase in times of general struggle and angst. Intersex people are already amongst the most vulnerable persons within the LGBTIQ+ spectrum. But other factors can amplify the challenge. Gender identity, economic status, and sexual orientation were named as the biggest aggravating factors by participants, with the economic status being most prominent in Southeastern Europe. When asked to mark areas of their lives where they felt an impact of COVID-19, a majority of all survey respondents chose the area of mental health, 67%, and traveling plans, 64%, and the latter is strongly connected to intersex activism. This is why it's so high. The financial situation for the total of respondents ranked 3rd. We will see in the following slides how critically the pandemic impacts in these three areas, and I will highlight some of the possible reasons. Easy and affordable access to general healthcare becomes even more important during a pandemic. And unfortunately, this access is not guaranteed for a substantial part of the survey respondents. 40% of all intersex respondents reported that their doctor's appointments were postponed, and 22% of all intersex respondents had their appointments being cancelled during the crisis. Now, it's important to understand that seeing a doctor can be a re-traumatizing experience for an intersex person. So the decision to take an appointment can be emotionally demanding. When such an appointment is cancelled or postponed, the ongoing stress of waiting for another appointment can impact significantly on an intersex person's mental health, and of course also on their physical health, depending on the issue. Experiences of disbelief, harassment, and violence from healthcare professionals, and the lack of knowledge among general practitioners about the existence, let alone the specific health issues of intersex people and needs of intersex people, have been widely reported as aggravating factors already before COVID-19, and COVID-19 has aggravated the situation. Many intersex people need to follow a medicine-taking regime or take hormone replacement therapy on a regular basis, which 40% of the intersex respondents of the survey stated that they do. So this also includes hormone substitution as a result of surgically induced loss of hormone-producing tissue. Of those 40% who take medicine on a regular basis, 28% reported that they had to stop or would eventually have to stop taking their medicine. So this means that 10% of all respondents, of all intersex respondents, were at risk not to being able to take necessary medicine in July 2020 due to the impact of COVID-19. In regard to access to healthcare related to a possible COVID-19 infection, we also see a problematic situation. 20% reported COVID-19 symptoms, but only 2 went to see a doctor. And 11 stated, when asked for a reason, that they didn't go to a doctor because doctor's appointments are too triggering due to their intersex-related medical trauma. But there were other things too. Like in some countries, intersex individuals with COVID-19 face severe risks to their safety due to the way the medical care for COVID-19 patients was set up. So one participant wrote, "I'm very afraid of getting COVID-19 because of my medical intersex trauma and the fact that the doctor's appointments are too triggering for me. The problem is compounded by the fact that in my region, COVID-19 patients are registered with a local therapist, and the local therapist does not accept without a minimum medical examination, which includes a gynecologist or urologist." And clearly these kind of examinations have nothing to do with the COVID-19 infection. Let's turn to another area. Personal face-to-face connection has been key, as Sivan mentioned, to the emergence of intersex communities on national and regional levels. And against this background, travel restrictions and other restrictions have a multidimensional impact on intersex people and their families. In addition to the significant impact on their well-being, they impact negatively on intersex activism. For example, through the need to cancel travel related to intersex activism, to cancel or postponed intersex community meetings, events, or projects, and only some of these can be changed to an online format. In addition to the external restrictions, the majority of respondents were worried about the ongoing negative impact of isolation and reduced in-person contact, and how these would further impact on their mental and physical health. And this included worries that they would lead to a reduction of capacity to continue intersex activism, both on a personal and also on a movement level. And these worries were expressed across all sub-regions. And in the past month, we all as the European intersex community and OII Europe have really tried to mitigate this risk. And hopefully we were able to do that successfully. Another area, economic situation. As we know, the pandemic is impacting on many people's economic situation and financial stability across the globe. And as the 2019 FRA LGBTI survey showed, intersex people are among the most vulnerable groups in regards to the financial and work situation already. So that survey showed that 51% of intersex respondents of the FRA survey confirmed that their household's total income makes making ends meet difficult. And of the 29% of intersex respondents stating that they experienced housing difficulties, 37% said that this happened due to financial problems and insufficient income. And the findings of OII's COVID survey show that this pandemic has just aggravated an existing situation. From our respondents, 41 stated that their financial situation has become worse during and as a result of the pandemic. We had 21 persons stating that they experienced severe income reduction, and half of them were struggling to survive. Furthermore, 30% of the survey participants stated that they have to spend more money during the pandemic, as they usually do, for example, but not limited to increased cost of medical bills. This is just a small overview of the most important findings. The findings of the report show the particular vulnerability. It's sort of like emotional of intersex people in times of crisis. The aggravating factors specific to intersex people, but also the resilience of individuals and the will of the intersex community and movement to survive. I'm sure we will hear more about this aspects from my colleagues from the other regions. Thank you for your attention.
Thank you so much, Dan. Next, I have a question to Hiker. Hiker, in your survey on the situation of intersex people's lives in Asia, a significant number of people said that they were reluctant to seek medical help due to prior experience of medical violence and trauma. What are the other main findings regarding the impact of the pandemic on the intersex community in Asia? How did your community support each other in such times? Hiker, the floor is yours.
Okay, yes, in Asia, especially in rural area, intersex people are easily exposed to neighborhood to confront the severe social discrimination directly and daily. Many Asian countries share the similar superstition, seeing intersex people is a bad omen or a monster. Some families treat intersexual in a very negative way. The issue here is a result of social discrimination. Medical professionals may not respect your privacy or even mock at your condition, even when they have no proper knowledge about intersex at all. Discrimination is scary and traumatic. It's even worse to be discriminated by medical doctors. Another point is low income. Many intersex cannot afford to go to hospital and to do examination. So the main finding and economy, unemployment, mental health, and education are the top 4 impacts to intersex people during the pandemic in our survey. Under this finding, I see 2 critical issues related to get resources during COVID-19. They are lack of internet access and lack of ID. It may leave intersex people behind the government protection and support. And indeed, financial support from the government during COVID-19 is almost zero in this survey. During the pandemic, when lockdown became a common and a regular lifestyle, internet access became our major connection to almost everything and each other. Almost everything, and to connect each other nationally and internationally. Internet access, including having a smartphone and knowing how to use it, are the ways in getting information, continuing education, working online, and even consulting with doctors online. But many intersex people in our survey don't even have a smartphone, not mention internet access and know-how. And due to discrimination by families, many intersex people has no registered ID. This is a special issue in South Asia specifically, because it is serious, because it can prevent people from access to all kinds of public service and the social welfare. Even nowadays, very important, the possibility to be vaccinated during the pandemic. And the huge impact from the pandemic makes us more connected. Intersex Asia initiates small amount of urgent fund to give financial support for surviving issue. For those who have no smartphone, we use a cell phone to communicate. The survey itself also create a further contact with members of our member organization, helping us to understand the ground reality and helping them to evaluate their own situation. Most intersex people we support felt released and are happy to join the survey, even though it took a long time to complete it. Okay, thank you.
Anyway, the survey situation in Latin America, which you're currently preparing, has the biggest number of participants of all regions. Are there any early findings you're able to share with us on the impact of the pandemic on intersex community in Latin America, and how are you supporting each other in your community during such times? Thank you, Gaby.
¿Qué tal? Buenos días.
Yes, first of all, I would like to greet everyone, and I would like to speak about the main findings in Latin America, the findings of this survey that we did among about 80 people. It was one of the biggest surveys carried out, and we have around 56 intersex people who gave their replies about the issues and problems that COVID-19 has brought about for them. And we also had members of their families who could reply to the survey. Among these people, among this group, 60% mentioned that their greatest problems were related to their economic status, which highly affected their quality of life. So it became different than what they had known up to that point. Many of these people have been facing vulnerability regarding their gender identity and expression, and this also relates to the rest of the surveys mentioned by my colleagues around these issues. So most of these people have experienced severe needs, economic needs, and of course, discrimination and hate speeches towards these people have also increased. 40% of this group expressed that they have seen their emotional and physical health worsened by this situation. So access to health services has been an issue, and they have also been affected psychologically. 64% of these people mentioned issues regarding their access to employment. And many other people also mentioned that their access to education was also hindered. So we can see that they have been affected regarding different areas, be it economy, health, security, and also access to continued education. So we can see that the pandemic has affected people at all kinds of levels, and the security issue that represented that their quality of life became lower. Many of these people also mentioned that they could not attend their medical appointments with the same frequency as before. Also, due to the fact that many medical professionals do not really understand the experiences of intersex people regarding their identity and expression, as well as physical manifestations, and this reflected on their access to health services and sanitary services. We could also see this increase in the costs of life, and in most of the countries in Latin America, there was also an increase in the inflation rate, and this meant that access to housing and food was further reduced for vulnerable people and communities. In the context of the pandemic, many people lost their jobs, and this had deep consequences for the general well-being and health of the people. So this is just a summary of all the areas that could be assessed through this survey. And later on, we will be able to access the more detailed report. Many thanks.
Thank you so much, Gaby. And I'm so grateful to everybody for staying with us despite the technical problems. Obioma, your survey shows that the pandemic highly increased risk of intersex persons not being able to receive financial support, with a history of discrimination at workplace and an inability to gain employment. What are the other findings of the impact of the pandemic on the intersex community in Africa? How did your community support each other in such times?
Thank you for that question. And once again, hi to everyone. I'm happy to be part of this conference once again. Apart from the findings of financial impact the COVID had on intersex persons in Africa, there are numerous other challenges and impacts it had, but I'm going to, because of time, I'm going to speak on the top 3. Apart from the financial and economic impact, I'm going to speak on the impact it had on the safety and human rights of intersex persons. The safety and human rights of intersex persons were hugely impacted during the COVID. The pandemic brought total confusion and limited movement, reduced mental and physical health, and individuals' lack of safety. Response from the African Intersex community showed that 39% stayed at home in self-isolation with people they have strained relationships with, including their partners, families, or friends. 24% experienced violence, harassment, or abuse on the streets, while 14% experienced violence, abuse, harassment, or controlling behavior from someone they currently live with. It further showed that other experiences of controlling behavior and personal safety issues were also experienced during COVID-19 restrictions. And this also triggered medical trauma that intersex persons have had in the past. One respondent said that they felt being insulted with different means, being due to the fact that my intersex situation, and from my landlord, because I was not up to date in paying my rent because of the lockdown. My shop was shut down and my place was taken by force. Another respondent also noted that now I have to talk, do or sound, express myself as my father wants me to, or I face being kicked out of the house. While another respondent mentioned that I was stigmatized by my family members, I was always addressed by the wrong pronoun, I was discriminated against because I looked different. These are some of the response our respondent field during the survey. So I was talking about the third most crucial part of the impact of COVID-19 on intersex community in Africa, which is healthcare. During the pandemic, access to good healthcare was not guaranteed, as many respondents showed. there were multiple cases of not being able to access healthcare services. 34% of intersex respondents currently have no access to doctor with relevant intersex experts on their body, while 28% said they had doctor's appointment postponed, and 24% said that intersex 24% of intersex persons reported that worsening health conditions were experienced during the COVID-19 due to lack of access to healthcare services, while 21% said that their treatments were changed, and 17% of respondents respectively mentioned no access to doctor that they could trust due to the pandemic, and necessary treatment was postponed and doctor's appointments were cancelled. It also showed that access to medication during the COVID-19, and this can be seen that during lockdown, when most countries had to lock down because of the peak of the COVID, they could not access medication due to lack of money. This 28% saying that they couldn't access medication due to finance to purchase the medication, while 14% showed that medication was unavailable at the pharmaceutical shops where they normally purchase these medications, while 10% said that they couldn't get access to their medication due to pandemic-related restrictions. Also, another crucial part of the impact was on mental health and well-being. The mental health and well-being of intersex persons in Africa were greatly affected. And due to the fact that not just because of the pandemic, before the pandemic, most intersex persons always have challenges, facing challenges with their mental health and well-being due to trauma or other discrimination and marginalization that they have faced. So these also increased during the lockdown, social isolation, and fear of the unknown, increased feelings of anxiety and fear. When asked about their mental health, 14% expressed substantial worsening of their mental health. Many others indicated an extraordinarily strong, medium, or slight worsening of their mental health. Some say that stress and anxiety became factors that they experienced during this COVID, while others experience uncertainties of what will come out from the COVID, made them to become more isolated, self-isolated during the pandemic. And they could not get support, many people, due to the loss of employment. Lots of companies and workplaces closed down during the lockdowns. So they could not get the financial support they normally get. And there was no sense of support from the government either. And also they feel stress from this kind of change that they experience. Most of them have not experienced the changes of that COVID-19 brought. They had to cancel a lot of plans, a lot of travel plans, a lot of educational plans, and a lot of business plans too. So this also brought a lot of anxiety upon them. And also some indicated that their mental health also became a very huge problem to them, because they could not also access professionals who could also help them to also cushion the effect of the mental health issues they experienced. About 45% said not seeing a medical professional at that moment, while 24% mentioned stop seeing a medical professional due to lack of money. So you can see that finance and income hugely affected some areas of their life, and they are all interconnected. Just like our first speaker said, Sylvan said that there's a lot of intersectionality that intersex persons face. We can also see that is playing out in COVID-19 for a lot of intersex persons, not only in Africa, but other regions. Conclusively, they hoped that the COVID will go away so that they can go around their normal lives. But intersex activism too was hugely affected, because before now, intersex activism in Africa have little or no fund to operate on. Then in COVID, a lot of restrictions were made. So even NGOs that are intersex-led could not also access their community members, and there were no funds, because funders had to channel maybe to other sources of other areas of COVID. And knowing that intersex activism have little or no funding around the globe, not only in Africa. It's also affected African who were able to stand out and help and support their community members. Some provided vouchers and palliatives and peer support to their members as much as they could, even though they don't have that support. But there were calls over the internet, but not everyone had access to the internet. So it's also restricted the peer support that could have been given. But apart from that, a lot of intersex organizations were out there making sure that their members could be supported as much as they could. So this is how we have been coping here in Africa over the last 1.5 years that COVID started. Thank you.
Thank you so much, Obioma. And it was such a wonderful experience working with you in this report and supporting you from the technical side. And yes, all the reports are available online. So if some of my colleagues, I'm still turning on my laptop, if some of my colleagues could please send the African, Asian, and European reports in the chat, that would be great. Anyway, thank you so much to all the amazing speakers. And believe it or not, despite everything that happened, we are almost on time. So there is a lot to say, but yeah, unfortunately, COVID-19 is still with us even 1 year later. And this is actually what our next panel will be about. Thank you so much again to all the speakers from our first panel. And now I give over to Irene with the second panel. Thank you so much.